Well, let's get started, everybody, because we have a lot on our plate tonight and it's all good. Welcome to everybody. Good evening to this really exciting Let's Talk discussion. My name's Jackie Davis. I'm your facilitator for the evening, and I am joined by the awesome team at Marin Healthy Youth Partnerships. Many of you already know that the Let's Talk booklets historically have been sent out to every family of 6th and 9th graders here in Marin County, and that's what our discussions are based on. But this year, very new for the first time, we actually have all of that content available on a brand new website. You can still download those booklets if that's the way you take in information best, but all of that info is now available in bite-sized nuggets. You can browse the website on your own time and own pace. We're going to put the link into the chat so you all have that available for you. Thanks, Melissa, to check out that new website and get that information, which is pretty exciting. You know, we often say that the Let's Talk discussions are where we come to get the science and the research on substance use and parenting, but it's also where we come to tap into our intuitive wisdom and heart as parents and community members. And I think tonight, more than any other night, really exemplifies that approach. And the reason for that is who we have speaking tonight. So tonight we are joined by Dr. Lisa Santora, none other than our very own public health officer, which in the public health world is like the famous person. So this is really exciting. She was assigned to this position last year after serving 9 years as Marin's deputy public health officer, and she now provides clinical oversight for public health emergency preparedness, communicable disease prevention and control, and detention health for the county. She also brings vast experience in underage substance use prevention. And really importantly, she's also a mom raising kids right here in Marin. And so tonight, she's bringing that science and research lens. There's no one better to do it for us, but she's also here as a parent. And I really love that she's bringing both of those hats to us tonight. We're also joined by Sam Adkins, who is a really awesome junior at Tamalpais High School. He was a summer intern with Marin Healthy Youth Partnership, and he is now. So he's here to talk about his experience being a youth advocate in this space, and he'll also be here for any youth-directed questions that come up at the end of our session, which we love.
All right, I am shifting to slideshow. Do you see that now? All right, we're moving on. I apologize, all of a sudden everyone froze for me. My name is Lisa Santora. I'm the health officer for the county. First, I want to thank our translator, Isabel. Gracias, Isabel, por traducir esta noche. Soy de Nueva Jersey y a veces hablo rápido. Intentaré hablar más despacio esta noche para facilitar esta traducción. So I just shared with Isabel, our translator, that I'm going to try to speak slower. I'm from New Jersey originally, and sometimes can speak quickly, especially in public presentations. So I'm going to try my best to slow my roll a little bit. I am super excited about being here tonight. It's a full circle moment for me because a lot of the community presentations I did were during the pandemic. My primary goal during the pandemic was to ensure the reopening of schools across the county and our private and public schools. That was led by my mama bear spirit. When the pandemic hit, I had a 5th grader and a 3rd grader. Well, actually a 4th grader and a 2nd grader because it hit in 2020 over that spring break that was supposed to be only 2 weeks. And then they re-entered the school year as 5th graders and 3rd graders. So I stand alongside many of you on the call of having to navigate the pandemic as a parent and as a working parent. And now as a parent, learning how to adapt and support my kids navigating adolescence. In some ways, it's a lot harder than a pandemic. So another lesson that we knew was going to come is that the pandemic was often described as an earthquake. And then there was a tsunami to follow, and that was going to be the mental health challenges that our community faced due to the social isolation, and especially with a focus on our youth and our older adults in our community. So again, it's just a full circle moment for me I'm really grateful for Marin Healthy Youth Partnerships and the rest of our larger community, our village, for hosting this tonight and for having the Let's Talk campaign. I saw it as a parent, and I also have been to the website, and I continue to learn. And I just want to echo Melissa's agreements. It's a judge not space. That's my primary rule in our household, is to judge not. It is so hard to be a parent. It's so hard to be a working parent. And I am just, again, grateful to live in this community. So I'm representing public health. People got to know us well during the pandemic, and we're here to protect the community. In some ways, it starts with promoting health, like tonight. We also focus on preventing disease, and then we also prepare for emergencies. We just left our National Preparedness Month. And it's getting harder to do with some of the changes that are happening at the federal government. And that's why it's so important for us to really focus locally, because there's a lot that we can do locally on all fronts, including adolescent health. So my purpose is my family. I serve as a health officer, but I'm led by serving as the mom to my family. This purpose led me to Marin County. I moved to Marin County in 2015. And even with the data that I'm going to share with you tonight, I chose to live in Marin County because I thought and continue to think it's the best place to raise my kids, to live so close to San Francisco, to be among this amazing nature and in this community. I am just so proud to live here, and I'm really thankful for the community that surrounds me and my family and supports us. So I always share with my kids, my job as a parent is to keep them healthy, happy, and safe. It depends on what the day is or what the moment is, whether I'm more concerned about their safety or about their happiness, and it depends. But that is what leads me, again, not only as a parent, but in my decision making as a health officer too. So as I said, I'm going to share some data that can be concerning for some, worrisome, or frightening. But I want to lead with optimism. I'm thinking of Jane Goodall a lot this week, and she led with a lot of hope and a lot of optimism. And a lot of the core messaging she had was not around our animal community, but was also just around our community and the importance of connection, which is so important right now as we move forward. I found this survey about Gen Z. My kids, I think one is an alpha, but she claims Gen Z. She's a young Gen Z. And they are an optimistic group. 84% report seeing a great future ahead of them. 56% report that they're thriving and they are enjoying life. Nearly 80% feel like someone cares about them at school, that they have a teacher that makes them excited about the future, and they're excited to get good grades. So I want to share that optimism, and then hopefully we can share some of these slides. If not, we'll make sure people have access to this article. We all navigated a pandemic together, but there were silver linings through that. I often described in many of the community presentations that I believe this generation is our next greatest generation. They're going through so many challenges and adversity and innovation at the same time. And I really do believe this is the next greatest generation, even though around us it can feel very disconcerting sometimes. I look at my kids and I know they're better than I was at their age. So these are just some of the silver linings, and it's almost how you described with Sam. These are the silver linings of that generation. It built a lot of resilience among our kids. It sparked innovation in technology and education. We're all adapting to AI now. Before the pandemic, we couldn't even think of AI being part of our day, and now it's ruling our day, maybe even too much. A lot of people reconnected with their purpose and learned how to connect with their community. And even more important, I think we all saw how important nature was, especially in Marin County, and being able to get outside during that time. And that's something I continue to support with my kids, is again, connecting with nature, because it can be so reinvigorating and refreshing, especially when you're spending so much time on the screen. So now on to the harder part of the presentation. COVID was detrimental to our youth and to us. We all have still are struggling and still are in recovery from the pandemic. Many members of our community suffered significant financial impacts from the pandemic itself. The toll of remote learning and virtual school, it was a significant impact on our community. And so kids are still adjusting with an uncertain future. Their mental health challenges are intensified. We hear about anxiety and depression at greater levels than we ever heard about in this youth population. And the socialization, that's one of my biggest concerns with my kids, is they lost that socialization at such a critical point in their development, between that late elementary school time is when they're forming friendships and learning how to interact with adults. And a lot of our kids got kind of stunted in a way because they had to adapt to this virtual learning. And it's showing in the data and all of these detrimental effects. On the left side is just some of my favorite pictures. Again, some of the negative side of COVID and being in school. It wasn't a natural environment to be remote learning. It wasn't natural to have masks on faces and not to make those human connections. I look at the child on that left corner, and they're just are surrounded by screens. Like, there were so many screens in my household, and then we now are seeing through research that having increased screen time causes significant challenges, but it's the way our kids connect. I talk to my son almost on a daily basis around his screen time. I'm monitoring it, but that's how he's connecting with his friends at school. They're playing video games and they're talking to each other. So how do you strike that balance when you see the data where it can cause more mental stress and emotional stress, poor body image, and even suicidal thoughts of suicide with increased screen time. So how do you balance that as a parent? And like Melissa said, there is no silver bullet. We're all learning together. And again, that's our hope, is that we're just sharing data and information with the community to help provide you with resources, and to support you and make sure you feel like you're not alone. And also to help inform your own decisions, having data-driven decisions as a family, and also evidence-based decision making. So there's been a lot of research on substance use in adolescence. It's been over 50 years where we've been studying this. Most significantly, it was in the early 90s where we started measuring. Data is so critical to our understanding of any injury pattern or illness in our community. It should be driven by data. And in the 90s, we started having surveys like Monitoring the Future and Youth Behavioral Risk study. And that allowed us to learn a lot about what were the risk factors for substance use. Some we know intuitively, having a family history of substance use, and you can't control that. But there are other factors that are very controllable. Your own substance use, having a positive attitude towards early initiation, not supervising your kids, and we're going to review some of the data around that. So this is based on data. It's based on almost a half a century of data, and especially during the past 35 years. That being said, and I think it also reflects how we started the conversation today, we didn't have our first published Surgeon General report until 2016. Substance use comes with significant stigma. We don't like to talk about it. We don't like to share our challenges as a family when we're struggling and facing our own personal or family crises as a family. And so I think that's why we didn't see that first report on substance use in our country until 2016. So we still have a long way to go. And I'm really proud. You'll see some of the resources later. I was seeing some of the campaigns around stigma and just talking about it, because that's, once you talk about it, that's how you can learn and how you can make changes personally or for your family. So we're just going to run through the risk factors and go through some of the data that's behind that those risk factors. The first one is early initiation of substance use, and peer substance use and early initiation is before 15. As I mentioned earlier, the family history of substance use, adverse childhood experiences, which over the past decade, we've been learning a lot more about how trauma in one's life and really can shape your health and well-being as you advance across your life course, and also low parental monitoring. Parents make a difference with substance use among our adolescents. So just starting here, I found this screenshot. It happens in our community. So we saw in Mill Valley a report where almost 200 kids were underage gathering and using mostly alcohol at that point. They might have been vaping and other things. And so this is part of our culture. It is part of living in Marin County, is that we do have early initiation of alcohol, especially, and other drugs among our youth. So I'm going to run through, this is data that we get from California Healthy Kids Survey, and I'm going to run through the different substances that our youth are experimenting with or using. And so the first is vaping. We hear a lot about this. We've heard it in the past. Before the pandemic, actually, we started hearing about increased vaping, especially in the middle schools. And you'll see on the series of slides that I'm going to show you is on the top part, you'll see the percentages and the rates for California, and then we'll be comparing that to Marin County on the bottom part of the graphic. And then what we're looking at, and a shout out to our epidemiology team. There are data experts at the county for helping compile this. We don't have, we have to compile years because we don't have the numbers, and in order to have a significant sample size to really make sure this is valid data, we often combine years to make sure it's valid. So we have 3 timeframes we're going to be looking at. So we have our pre-pandemic timeframes, 2015 through 17, 2017 through 19, and then 2021 through 2023. And when I look at this, I see something reassuring here, even though we have higher rates as we go across those timeframes. We see a significant decrease in vaping between the 2017 and 2000 between the 2017 and 19 timeframe to the 2021 and 2023 timeframe. So that is an improvement. That being said, when I also look at this, I see us at much higher rates than we see at California for every time period and for every grade level. So when we're looking at today, we see that 3% of our 7th graders report vaping. That doubles by the time they're in 9th grade. And then we see a significant jump at 7 to 17% of 11th graders reporting that they're vaping, which is why, again, we are fortunate in Marin County to have a smoke-free coalition that is working to implement laws and policies that create more barriers to accessing both vaping materials and tobacco in our community. So then shifting to cigarette smoking, people aren't just vaping, they also still smoke cigarettes. It always blows my mind when I still see people smoking cigarettes, but it is, again, part of our community. Again, you'll see California on the top, and you'll see Marin County on the bottom of that graph. And you'll see that, again, with cigarette smoking, we have much higher rates than the statewide averages for all timeframes from 2015 through 2023. And then for our all grade levels from 7th grade to 9th grade, 9th grade to 11th grade. And you see the most significant jump of use of tobacco is between 9th grade into 11th grade. And again, just looking at that, it's less than 10%, which is a significant improvement than in past decades. But that's because there's other options like vaping that didn't exist in decades before. So there wasn't a vaping option for others, and now there's a vaping option. So again, this is something that we continue to closely follow. And again, how do we use policies to reduce access to both cigarette smoking and to vaping in our community? And then marijuana use, again, we compare California to Marijuana County, not Marijuana County, Marin County. And this is one of the most concerning slides for me and the most concerning data points for me. You'll see we have significantly higher rates of marijuana use in our 11th graders. We're on par with the state at 2% use for our 7th graders. We have a significant jump for 2% to 9%. From 7th grade to 9th grade in using marijuana. That being said, and looking at the bright side, if you compare 2021 and 23 to 2017 and 19, we see it's a much lower jump from now than it was back in the 2017 and 2019 time period. That being said, we still catch up by 11th grade, where 25% of 11th graders are reporting using marijuana in the past 30 days. And that ranks us at 4th in state of marijuana use. So when we're compared across all counties in the state. And just, I think it's important to recognize that this is a pyramid or a triangle where we see vaping leads to potential tobacco use, and then is the entryway or gateway for marijuana use. So again, it's really important that we understand this connection between initiating vaping early and then also potentially advancing or progressing to marijuana use. So now shifting towards alcohol use in our community, and this is a report of any alcohol use in the past, alcohol or any drug use in the past 30 days. And so again, looking at California compared to Marin County, you'll see we're significantly higher. We're almost have double the rates across all grade levels, and those rates were double almost in every time period back in 2015 and now in that 2021 to 2023 time period. So we have 5% of our seventh graders reporting any alcohol or drug use. So this is just any. It jumps to 17%. So increases by 3 times between seventh and ninth grade. And then it doubles again in 11th grade. So, and that's nearly triple the state average, which is, again, is deeply concerning. Oh, that was the binge, the binge drinking. I didn't have a graphic for that. So 16% of Marin 11th graders report binge drinking. That is the data point that's nearly triple the state average. So unfortunately, these are not the grades that we are seeking in Marin County. We are highest in the state, on 11th in the state for vaping, 3rd in the state for cigarette smoking, 4th in the state for marijuana use, 3rd in the state for any alcohol or other drug use, and then 5th in the state for binge drinking. And so again, that's why it's important for us to talk and have these conversations and parents to understand the data and see the data. And I want to go back one time. That being said, most students in Marin still do not use alcohol and other drugs. And so I want to reiterate that the norm for our adolescents is that they do not use. It is the majority still. So if 30%, 37% of 11th graders who are reporting any alcohol or other drug use, that means we have more than 63% who are not using at all. And so how do we make that the norm, that we have a larger majority of youth who are not using alcohol or other drugs? So just want to underscore that again, that while we have higher rates in the state, the majority of our kids are not using any alcohol or other drugs. So I want to shift to overdoses. This has become a significant concern for ours and for me as a parent, especially. Fentanyl wasn't part of our childhood. Fentanyl is one of the most deadly opioids that is in our community, and the increase of adolescent overdose deaths has been driven mostly by opioids and most specifically by the availability of fentanyl, which has continued to increase over the past 5 years. So when kids take a pill, they might be thinking they're taking a one pill, but it actually might be something that is containing fentanyl in it. When if they're using cocaine or thinking they're snorting just clean cocaine, it can have fentanyl in it. So we do not know what drugs, what pills that might be shared actually have fentanyl. And so that is one of my biggest concerns as a parent is I tell my kids all the time that you don't know what is in that pill. You do not know what is being fabricated and where it's coming from. And so that's one of our biggest concerns. Unfortunately, we have initiatives like OD Free Marin. We're working hard to implement strategies to reduce that risk in our community of exposure to fentanyl, which again, we know is causing a significant cause of overdoses, both non-fatal and fatal overdoses. Fortunately, now all that being said, we have less than 10 deaths a year among our adolescents. It's actually around 5 from opioid overdoses. The spike that you saw increasing nationwide, we see it reducing in Marin County. So we're not having the same ongoing increase. We've seen a significant reduction. And I do attribute that to the efforts of this group, these Marin Prevention Network and Marin Healthy Youth Partnership and OD Free Marin, all of the organizations working collaboratively together to make sure that information is out about fentanyl so people understand the risk of fentanyl, and also make sure there's harm reduction tools in place in our community like fentanyl test strips as well as naloxone. And we consistently hear stories from our community partners of naloxone being the availability of naloxone in our community being part of saving lives in our community. So I think that's why, unlike other communities, we've been able to start seeing a decline in fatal overdoses as well as non-fatal overdoses. And just to note that most of the overdoses in our youth are unintentional. They did not know. So it wasn't an intended suicide, which is a concern again as a parent. The leading cause of death for our adolescents is suicide. And now that this is available, this is something that is concerning, but Sadly, the majority of kids who had a fatal overdose in our community in the past decade, it was unintentional. And again, fentanyl was involved in 2/3 of those. So this is a reassuring slide for me. We have under public health, we also have our emergency medical services system, our 911 system, and we're also tracking data there. Again, how do we take data into action? And you can see in 2020, that's when we had the highest spike of non-fatal opioid overdoses in our community in that 2020. So we had 59, and then it began declining. And again, that's I think because of the collective action strategies that we've deployed in the community, from awareness campaigns to educational efforts in school and outreach efforts. That being said, we have a decline, but youth still account for almost 15% of the 911 calls for non-fatal opioid overdoses. And as a parent and as a health officer, that's a number that's still too high. And just because you call 911, you often don't stay at home. So many of our 911 calls, especially among youth, result in overdose hospitalizations. And so again, because of small numbers, we took data from 2019 through 2023. And in that time period, we had 25 kids between 10 and 14 who were hospitalized for an overdose. And then we had 67 in that 15 to 19 age group. And you saw our biggest increase on the right-hand side was in that 2021 year, the year following, still part of our pandemic year when school was still normalizing. And we've seen again a little uptick this year in opioid hospitalizations. Well, not this year, in 2023. So again, this is something that we're closely following. And again, I'm really proud that we have a data to action steering group that really again is looking at this data, engaging conversations with community partners, and then designing and developing strategies that can both share this information and then support the implementation of evidence-based interventions. And another shout out for OD Freeman. So I just shared what we have, and they have three committees. They have their advisory committee, a youth action team. It's really critical for youth to be at the center of designing the strategies, of creating the strategies and deploying the strategies. So I'm really proud of our efforts to center youth, and really again thankful that Sam is joining us tonight. Also making sure we have an intervention, treatment, and recovery team, making sure individuals are connected to resources that are available in the community and are taking advantage of those resources. Many of those overdose 911 calls and hospitalizations were not then connected to treatment services. Again, I think that often is connected to stigma, where families take their problems internally and then try to manage as best they can as a family, and then aren't connecting to the resources and supports that are available in our community to help navigate through recovery. And again, part of this is just being outreach and education and sharing the information so people in our community know the data, know the risks that exist in our community, and then can take action again at the individual level, the family level, or community level. So on to the next risk factor. So we completed our data set on early initiation of substance use and peer substance abuse. This picture that you see on the right-hand side is from a show called The Bear. This is an episode called The Seven Fishes, where the mom is drinking and cooking. It's a very stereotypical but very real Italian gathering. And when I saw this episode, I found it really relaxing because it reminded me of growing up and home a lot. That was a dynamic of our Christmas vacations. And then I realized when I talked to other people, they found this episode really stressful and created anxiety. And I realized that that's probably more of the normal reaction. That's because I come from his family with a history of substance use disorder. And that's why this issue is particularly important to me. I have a story. It's crazy to think that this is a true story, but it is. It wasn't until medical school that I learned that my grandmother was an alcoholic. I was in a class where they shared the acronym called CAGE, and CAGE is a diagnostic tool for screening for alcoholism, and the E of CAGE is an eye opener. And so even though I was 21, I thought it was normal for my grandmother to have alcohol and my grandfather to have alcohol at the start of the day. And again, it was normal for me. It's what I grew up in. It's what I thought was normal. And so I did not realize until I was in medical school that I had alcoholism in my family. I then, not surprising, I also have had uncles who have passed from alcoholism and overdose. And so I know, and I have shared this with my kids since they were probably too early, that they have the gene. And there's nothing that I can test for at this point to tell them if they have the gene for alcoholism and substance use or if they don't have the gene. But I know because I have a family history of alcoholism that my kids have a higher risk of having that gene. And so that's one of the pieces of information I share with them because it's not about me telling them what not to do. It's about giving them information that they can help inform their decision making when they're not inside my house. So we're just going to go through some of the data about alcoholism in our community and alcohol use in our community. I drink alcohol. I have a healthy relationship with alcohol, and I am like the majority of adults in Marin County. 89% of adults of alcohol, 89% of Marin County adults report they have used alcohol in their lifetime. 81% of adults in Marin County report that they still use alcohol regularly. 20% of adults report that they engage in binge drinking. And I think this is really important because that's the behavior that leads to harmful consequences. So you'll see the next bullet is that alcohol is involved in 1 out of 4 motor vehicle deaths in Marin County. And then we have this is an added slide, about 17% of our community adults report using marijuana. So substance use is common. Ideally, the majority of these adults have a healthy relationship with substances and they're not driving while using these substances and they're not binge drinking and causing harm to their liver and other organs. But we also see that that's not the case. So on the left, you'll see, and I'm going to walk you through it. You're going to see what are the leading causes of death in our community. And I didn't want you to get overwhelmed with the slide, but what we see in the blue is as you're younger, not surprising that most of the deaths in our community are injury related deaths. We have overdose, like we've talked about, we've had suicide and road injuries. Not surprisingly, for me as a physician, is that alcohol-related deaths, that's you'll see it's the second lead at the 35 to 44 group becomes the second leading cause of death among that age group. And it continues to be in the top 3 leading causes of death up until 64. And alcohol, again, I think people don't realize how many alcohol-related diseases and deaths are in our community because people don't talk about it. And so again, it's something that those age groups from 35 to 64 are the parents of the adolescents in our community. So if we're seeing these negative outcomes, death being the most negative outcome and being the leading cause of death, we can see that how prevalent alcoholism is in our community. Again, we also see drug overdose and suicide are major midlife risks and also peaking between 35 and 54 years old. And again, you often don't see what happens behind closed doors in our community. So drug and alcohol use are a part of many of the lives of our young adults and our kids and our teens. It's part of the fabric that they grow up in their family. And again, that's why it's just so critical to have conversations like today, to share the data, to try and reduce stigma around this so people can feel like they can ask for help and that we can provide those resources for people to get help. The next factor, and we've learned a lot about this during the past 15 years, is adverse childhood experiences. People experience trauma in their lives, and that often will set the course of their development and engaging in riskier behaviors to not adapt, but to numb the pain that they're experiencing from those adverse childhood experiences. And I think our goal is to understand what those adverse childhood experiences are. I'm really proud of organizations like Marin Community Clinics that are screening for adverse childhood experiences and helping individuals see that it's sometimes the trauma then they can get, and also trauma that they can address in their lives that can help them have interventions and get the help that they need so they can navigate towards more healthy behaviors and healthy lifestyles. So what we've seen is that individuals with higher ACE scores are individuals with higher ACE scores have a higher risk of early initiation of substance use and also have a higher risk of lifelong substance use. Data shows that 39% of our kids experience one or more ACEs. And then among our Medi-Cal population, we have 8%, so nearly 10% screened for 4 or more ACEs in their lifetime. That puts them at high risk for toxic stress. And again, as I said, early identification is critical, making sure that we provide trauma-informed care because that can help people connect to services and, again, reduce the risk of long-term health and behavioral health impacts of adverse childhood experiences. And so what are those adverse childhood experiences? So the state has done research on this, and I took the data for all incomes, and there is some difference between high income and low income. But for all incomes, divorce and separation is the leading adverse childhood experience, followed by having a household member with mental illness. Among our highest income groups, it's actually having a household member with mental illness is the leading cause. The leading ACE in that group at 10% for the higher household incomes, and that's over 100,000 households that have an income over $100,000 a year. Having a household member with substance use disorder, like I spoke about previously, is around 10%. And then witnessing domestic violence is about 8%, again, across all households. And that's another thing that we often don't talk about in our community is domestic violence and the stress that causes not only for the family unit itself, but for the children that are living and observing domestic violence. Again, how finding a way to numb or escape from those adverse experiences, that's what often will lead towards, again, early initiation of substance use. And lastly, low parental monitoring. That picture from the slide on the slide is a real thing. It's how I grew up in Jersey at starting at I think around 6 o'clock. We had like only 3 channels, but it asks you, do you know where your children are? And it was not uncommon for a Gen X child to still be out of the house unsupervised at 10 p.m. and for the need for there to be a public service announcement reminding parents that they need to find their kids by 10 o'clock. That is that's something I think that's improved, though, obviously, maybe too much, maybe with the pendulum swung too much, but I know exactly where my kids are at with their phone right now. But again, parental monitoring is key to preventing early initiation of substance use. And it's good to know where your kid is at 10 o'clock at night. And that's part of the stories. You're not going to be able to read these snippets, but when children are sharing why they think kids are using drugs early or alcohol early, they also often attribute it to house parties being allowed in parents' homes, parents being okay with them drinking, and so not having those boundaries. And so that's what kids are identifying as it's allowable. It's feeling like a permissive culture around drinking, and that is again a key factor in early initiation of substance use. And I wanted to share this slide because I know there are parents, and might be parents on this phone, that support early initiation of substance use. And as I mentioned, we have over 35 years of good data that shows that early initiation of substance use is not good. There's rationale, and I think on the left-hand side, you'll see a lot of the things and thoughts, the things I hear and the thoughts I've even had myself, especially as I'm thinking of my kids navigating into adolescence and knowing that they'll hopefully be going off to college, and I won't be able to have an eye over them, and they're going to potentially make choices themselves to drink. So one of the myths, and these are myths, that it's safer to drink at home. But research shows that kids who drink at home are more likely to binge drink and drink unsupervised later. I shared a little bit. It's part of our culture or family tradition. I come from an Irish-Italian home, and so I actually was always allowed to have access to alcohol. It was not a taboo in my family. For me, if I did not like alcohol, I saw the behavior of some of my relatives, and for me, it was a natural aversion. But introducing it as part of your culture is going to normalize drinking and poses an increased risk of alcohol dependence. They'll do it anyway. So you want to allow. I always share with my kids, my job as a parent is to support their independence. My goal is that my kids aren't living at home when they're 18 years old and they don't return home after college. So I want them to be independent. But that being said, if we delay an initiation every year between 15 and or between 13 and 21 years old, it reduces the lifetime risk of addiction by up to 5%. So every year we could potentially delay them initiating alcohol. That's going to reduce their risk of dependency as an adult, which is important. Um, I also think, how do I lose my train of thought sometimes. It'll come back to me. I want to teach responsible drinking. This is definitely a fear of mine. I can imagine my kid being 17 and going off to college. And if I don't have conversations about the amount they take in and how they can hydrate, that I'm worried as a parent. That being said, before the age of 25, your frontal cortex is not fully developed. Adolescents do not have impulse control, and supervised drinking does not teach moderation. And so again, how do we have conversations about delaying initiation? And it is not realistic that we're going to teach them responsibility as teenagers. And then also just supporting their drinking because it's going to help them fit in socially. And this is a hard thing, especially in Marin County, where I grew up. We had a mall to go to. There were movie theaters. There were a lot of alternative activities. I had a boardwalk. I grew up at the Jersey Shore, so I had a boardwalk to go to. So there's a lot of things that could distract me from having to go to a party. And I think that's one of the challenges. Like kids get bored. There's not the same activities and not the same social gatherings. And so I think that is something, again, to have conversations and again, still talking to your kid about delaying the initiation. They don't have to drink at parties. The majority of kids in Marin County do not drink, and having different priorities, like having different goals and priorities like sports and how, for example, that's how taking in any alcohol or drugs can affect your performance, your musical performance, your artistic performance, your sports performance. Again, having those conversations with your kids about, again, how they can make decisions not to engage in drinking. And I think these are all good intentions. And I think this is the judge not slide. I know it's hard. I haven't made all the decisions yet. My kids are only 15 and 13, and I still have a 13-year-old who's asking me about, will they be allowed to go to high school parties? It's something they're looking forward to. So again, these are all things we're navigating together. This is a judge not let's talk session, but I want to share that although these might sound like good intentions on supporting your kids, there could be unintended consequences and there are risks for supporting, again, early initiation of substance use. And again, this final highlight that there is just, again, the lifelong consequences. And the biggest one for me is addiction. We see by 35, that age group of 35 to 40, it becomes the alcoholism becomes the third leading cause of death. Again, people don't see it, but when I was a practicing physician, I'm still a practicing physician, but when I seen patients in a clinic, I saw a lot of young people with hepatitis and severe alcohol disease, and they couldn't understand why they couldn't drink as much as their friends could drink. And we just don't understand that yet. And so addiction can lead to significant disease and mortality, even as early as 35 years old. I mentioned it earlier, your brain is still developing until it's 25 years old. We call it pruning. So in adolescence, in early childhood, in that toddler age group, that's when brains are forming, and we call it pruning, like neurons are developing and dying and growing and dying. This at the adolescence is the second highest time of that pruning. So exposing a developing brain to alcohol is going to increase their risk for addiction as well as mental illness. And again, that's another concern for me as a parent. And then also, I often talk about my job with my parents as a parent is setting my kids up for success. And academic performance is linked to substance use. And so again, how can we set our kids up for success and make sure that they're ready to go to school and they're ready to meet the challenge of school, because school isn't easy. So again, these are reasons why we want to delay the initiation of alcohol and other drugs.
Dr.
So
Santora,
now we're
about
swinging to
5
the
more
positive
minutes.
side. Perfect.
5 more
We're
minutes.
swinging back to the positive. Thank you, Jackie. So there are protective factors. Where I talked about all the risk factors, I just want to talk about the protective factors. So authoritative parenting, setting limits, setting boundaries. Kids need structure, and that's what we're here as parents to do. Bonding with your kids and spending time with your kids. Playing Monopoly is what we play card games at my house. We play Monopoly, we play games. And so making time to bond with your kids, having conversations about alcohol and drugs, not talking about it is not gonna is not gonna stop kids from experimenting. So having open conversations and setting rules and expressing your disapproval, and then when your child does experiment, using it as a teachable moment and having those conversations. It takes a village. We started off, Jackie introduced us as a village, and I'm again really proud to live in Marin County. There's a lot of efforts to work together to address substance use disorders in our community. One of those is our community health assessment. I'm really proud. Public Health partnered with Behavioral Health and Recovery Services for the first time to do a unified assessment. This assessment is done also in partnership with our 3 hospitals and our Office of Education and our community clinics. And we're working now to develop our community health improvement plan. And you'll see on the top row on the far right, we've identified mental and behavioral health and substance use as a top priority. And we're already starting to formulate how do we develop a countywide adolescent health strategy so we can stay unified, especially through the storms ahead that we're going to be facing in funding. And then just going to run through 3 slides really quickly. You're not going to see them all, but this is just to show all the partners in our community who are working together to create that village and provide those supports and services to our youth. And so again, a lot of communities don't have those supports. Lastly, just a quick promo for an upcoming Screen Sense education. Screen time, I am struggling with this, so I'm going to be attending this myself. My kids have had more than 5 hours sometimes of screen time, so how do we navigate that together? We are learning. And then lastly, last month was Suicide Prevention Month. You probably didn't catch it. I didn't highlight it too much, but the leading cause of death in 15 to 19-year-olds is suicide. And so just making sure that you as a parent or your teen knows to call 998 for any reason if they're feeling alone. Those 3 numbers will connect you to the resources that we have in our community. And anytime you're feeling like you're having problems drinking or kids having problems drinking, you don't know what to do, call 988. And this closing out, this is part of our family bonding. And one of the reasons I moved to Marin County is that nature. This is Stinson Beach. It's one of my favorite places to go to, even now in October, because it's like our summer. It's just seeing families together, people connecting. And I'm just really thankful to be part of Marin County and thankful to spend this evening with you. Thank you, Jackie.
Amazing. Thank you so much. That is truly the most comprehensive session that we're going to get. It is the science, it is the heart and the wisdom. And I'm just really, really grateful. I know folks have questions and comments. I'm tracking them in the chat. But before we get to that, Dr. Santora spoke in the beginning about optimism and about bright futures. And we really want to underscore that today. So we're going to hear briefly from Sam, our junior at Tamalpais High School, about what it's like to be a youth advocate and a leader in this space. That is the optimism, that is the bright futures. And so we'll hear from Sam and then we'll transition into questions for both. Okay, so we'll give you a moment to pull those slide up,
Thank
Sam,
you. I
and you
got
can
my
go.
slides here. There we go. Okay. Thank you. So I just have a few quick slides here about sort of what we've been doing with the internship over the summer and sort of my thoughts as, being in high school. So yeah, my name is Sam Adkins. I'm currently a junior at Tamalpais High School, which I have a picture of to the right there. And I'm 16 years old. I've lived in Marin pretty much my whole life. And I actually found out about this internship from school. It was in our little email that they shared with everyone, and it was I'm just really like care a lot about my community, so that was really interesting for me to just get more involved in my community, especially since I've seen how substance abuse at high school, especially TAM itself, is like it's really an issue right now. So I wanted to sort of address that. And yeah, so I just have 2 examples of activities that we did during the internship over the summer and sort of my thoughts on all of this as a high schooler. So first, this was an activity that we did over the summer. It was the Real Prompt series. So basically, we had these prompts of questions, and all the interns, we would answer some of these and give our thoughts. We'd record these voice memos to be made into reels like on social media and things like that. And they range from, things about teenage life, mental health, substance abuse, family, peer pressure. And it really just is something we just added to over the summer as the weeks went on, just recorded more voice recordings. And it really gives a voice to teenagers, and what they experience and how all these things affect their lives. Um, and also, if we can understand why teenagers are often turning to substance abuse and things like that, we can understand how we can address it as well. So that's why I think it's really important. Um, and it's just, really giving a glimpse into teenage life in general. And, mental health is, with COVID, it's definitely an issue. And increasingly so. And so that definitely is a major part of this. So that's why some of the questions were about mental health, coping, because a lot of teenagers turn to substances to cope with mental health. So that definitely adds to the issue. And also family, family issues with family are often a major cause of substance abuse. So that's also a very important part of the problem. Um, and yeah, and just certain things that, teenagers want adults to know about them. So, for example, I answered the question, what do adults underestimate about teenagers? And I think I said something along the lines of how teenagers are, we're a lot more like adults than adults sometimes think. We're not always, just kids. We, really have complex like thoughts and opinions on things. And it's more, more so than adults sometimes think. So yeah, I think it's really important to give a voice to teenagers and what they're going through and why, sort of the base of the problem, from their view. And then another activity we did was the underage drinking prevention infographic. This is the one that I made. Um, and so we just have five things that parents or anyone in the community can do to address underage drinking. And obviously, family is and parenting is a very important part of this. That's oftentimes the source of substance abuse. So, parent drinking habits and parenting, we outlined as like two of the major issues that parents can address to limit underage drinking. And also, age of drinking onset as well is very important because we found, the studies have shown that the later that teenagers start drinking, the less likely it is to be a problem later in life. And also education. I think a lot of people my age don't fully know the negative effects of substance abuse, and they think that, it's not that big of a deal if they just, do it every once in a while, or, and that oftentimes, that acts as a gateway into, worse drugs, and they sort of just goes down that path. And from a young age, it's not a good path to go down. Um, and so, yeah, I think just educating, if teenagers know more about that and how substance abuse disorders, mental illness, drunk driving, if all of that is made more apparent, I think, through schools, through organizations like this, that would be really important, as well as support resources, like counseling, healthcare consulting, things like that, therapy. I think, at TAM, they've definitely made a good effort to sort of offer some of those, but I think they definitely could improve and sort of just have like, I don't know, mandatory events or things to educate the students on the issues and the actual effects that can happen from substance abuse, because I think a lot of teenagers aren't fully aware of that. Um, and so, yeah, this is just two of the things that I did over the summer, but I just think it's really important for teenagers to be involved in this, because it's really, we're the ones who, have sort of a like first view of this issue and how it's changing and how it affects people. I've definitely, seen that at TAM, this is definitely an issue um, over the years I've been there. So, and yeah, I think COVID obviously, impacted mental health, and that's sort of this whole system of like mental health and, parenting, family, it's kind of all leading to this issue. So, yeah, I think just teenagers' voice is really important, and that's sort of what we've done over the summer, and what we'll continue to do over the school year. As I'm also going to be an ambassador, we have a good program there. So, yeah, just excited to do more work with that. That's it for me.
Awesome. Thank you so much, Sam. Can I ask a question? Because you showed those prompts, which
Yeah.
I immediately want to ask, like, well, every young person of any age, those questions. So you mentioned that those prompts were turned into reels. Is there a way that folks on this call can see what some of the responses were to those prompts or can view those reels?
I'm not entirely sure because I wasn't really involved in like
Or is
actually
that Amanda
fields,
maybe?
but
Okay. Well, we'll find that out. I don't know if other
okay.
people felt that way, but like looking at some of those questions,
Yeah.
I want to know all of, yes, Emily, me too. I want to know all of those responses.
Mhm.
Absolutely. And thank you, because that is the sort of that the bright futures. And it also made me think that's an interesting conversation starter with our own teens um,
Amanda did drop it
at
in.
home. Sorry, Kelsey, what was that?
Amanda dropped it in the chat.
Oh, wonderful. Thank you so much. So people can have access to see some of those. That's wonderful. Okay, we're going to open this up for questions now. I have some that I've documented from the chat that I will start with. Thank you, Amanda, for those links. And then we'll go ahead and we'll open it up for Dr. Santora, for Sam. Some of the questions got answered along the way in the chat as well. Dr. Santora, I'm going to start with you. Looking at the data, a couple people asked this, and are rates in Marin being higher than state average? What's in the water? What's going on in Marin County? Why is this happening?
I think a lot is the permissive parenting culture. I do think that's a strong contributor in Marin County. I think we see in other higher income counties that it is higher income youth that are more likely to engage in early initiation of substance use. But that also, I think we're all seeing some transitions too, that as I shared, there's a lot of adverse experiences, especially in our lower income families as well, that are increasing exposure to substances. And I also think there's availability. Um, Sam mentioned it, like kids get it from home first. So we have again alcohol in our houses, we have vape pens in our houses. California sober is acceptable in our community, and it is and I think of Sam, that's how I think of my kids. They see everything. You can't underestimate our teens and our youth. They observe us, they see us. We can't be hypocritical. So if we are going to drink and use, we need to have conversations with our kids. And again, I think that's one of the leading factors. And I think that's why even when I started the risk factors, I honed in on our parents because there's a lot there. And even if you look at that Sam slide, 2 of the 5 were parent related. So I think the youth are telling us I think it's a lot of it's us.
Yes, and you two did not coordinate on that either. And
No,
it showed up in
Sam
both.
and
Yeah.
Sam and I didn't see each other's presentation, but I think Sam could have done my presentation better. And it's because I think we need to listen to our youth. They're telling us they have the wisdom. They are complex thinkers. They understand. They've gone through, like I said, they're resilient. They went through a pandemic. None of us went through a pandemic that kept us out of school when we were 15, when we were kindergartner through 12th grade. And so we have a lot to learn from our youth.
Yeah,
So I'm
absolutely.
also really interested in those results.
Yes. We had a question, and I'm not sure we even were capturing data at this point, but we had a question about data trends now versus data trends in the 90s when some folks on this call were in high school. Do we have the means to compare? Have rates of adolescent use gone up? Have they gone down? Are they just different substances?
It's limited. So California is ahead of many states in that it has the California Healthy Kids Survey. One of the goals we have is that we across the county at every middle and high school that we have that survey completed every year so we can have that benchmark data. You saw me have to combine different different years to get the sample size to make those statistical to share that statistical information. So ideally we would have every 7th, 9th, and 11th grader in the county complete that survey or an equivalent survey, so that we can have that data available to us consistently. So no, we don't have that data from
Yeah.
our Gen X times. I don't think any of our Gen X's were surveyed. It really started
No,
after we graduated.
No, we weren't. We have
And we
anecdotal
might have lied
recollections.
anyway.
Right. So now looking forward, the data that we've shared tonight goes through 2023, and we have a great question in the chat. Do we have a sense of when we'll get to take a peek at the data over the last couple of years and see if that downward trend is continuing?
My hope is that we'll continue to have this, again, leading with data. We learned a lot during the pandemic that we needed to share the data in order to address the challenges of a pandemic. And I think that's the same approach we need to take with adolescent health. Not the challenges of it, but just the risks, some of the risks that our teens are facing, that we have this data. So hopefully we have an update by 2024. I mean, 2024. I know what year it is. By the 26-27 school year. And then hopefully after that, in the following school year, that we can actually, again, be able to say that every middle and high school are completing this survey or equivalent survey annually, so we can have much more consistent data and have the full sample of our students, so we can have more accurate data. The larger the sample size, the more accurate the information.
Great. And Paul, and for other people wondering when that data is available, we do post that on a data dashboard on the Marin Healthy Youth Partnerships website, and then it's publicly available in a lot of other spaces as well. So data question for Sam, Dr. Santora shared our higher rates in Marin than California average, binge drinking triple the state average. Does that track with what you're seeing on the ground?
I think it does because, just at school itself, oftentimes you go into just any bathroom on campus, there's always a group of people vaping in there, doing things like that. And also, I think like many high schools, there's definitely like a house party culture, and so there's a lot of drinking problems, I think, as well. Like, so both of those are pretty major issues at TAM at least.
Great. And then going off of your prompts a little bit, if there's one thing that you wanted parents on this call tonight to know, whether that's one thing about teens, one thing about substances, one thing about mental health, one thing you wanted parents to walk away with, what do you think that would be?
I think that would be probably like how important communication is, like just being on the same page with your teenagers, because even if it's uncomfortable or awkward to have those conversations, it's really important to like just be with them through the process, and it's because it's a hard process for high schoolers as well, and so just to be on the same page with them through communication and as they navigate high school and further.
Thank you. That's awesome. So I'm going to open this up. We can ask questions in the chat, but you're also welcome to come off of mute and share a question. I can't see everybody at once, so feel free to not wait for me to call on anyone. Just go ahead and unmute or type in the chat. And while people are working on that, I'm going to throw out a question actually that either Dr. Santora or our OD Free Marin team might be able to address. There was a little comment or question earlier from someone wondering if access to naloxone or Narcan was impacting 911 rates. Does it drive down 911 calls because young people have access to naloxone? And I'm wondering if there are any thoughts from some of our county-based experts in opioids and overdose on whether that tracks or no. Faye, do you want to take that?
Yeah, so I'm Faye Zanoff, and I'm part of OD Free Marin. And what I can share is I know that EMS has said they for sure don't get lots of calls. They absolutely estimate they miss, not that they miss, that they absolutely don't get lots of calls. However, what they've indicated is that over 30% of the calls they respond to, it's a bystander that has issued or administered the naloxone. And that's great news. And as it relates to youth specifically, I don't know. I'd have to look at I think Dr. Santora said youth was calling in about 15% currently for the 911 calls. So we can just look back and see if it's been impacted.
Awesome.
I haven't looked
Thank
at
you.
that. Yeah.
Thank you so much. And then Michelle, thank you for reminding us people can, naloxone works for a certain amount of time, and when it wears off, people can revert back to overdose. So we always, always, always have to call 911. And when OD Free Marin goes out and trains community members and young people on naloxone, they definitely share that. So that's really important. Sam, I have a question that came into me directly that I think is for you. Essentially, that teens seem so much more aware of mental health these days, so much more versed in social emotional language than any of us were when we were younger. And you mentioned that a lot of young people are using to cope. Do you think that young people are aware that that's what they're doing, aware that they're coping with substances, or not as much?
I think it really depends on the individual person, but I think a lot of the time they are, they're aware of the dangers and they're still just using it, and they are aware of that. But I think other times people don't fully know the full effects of substance abuse, whether it's alcohol or marijuana or anything like that. So they don't really know how detrimental it can be later.
Yeah, yeah, thank you. We've got a great question that can be tossed to a bunch of folks in the room. What programming are high schools doing to educate kids directly about drug and alcohol use? The short answer is it depends. We have, what is it, 18 different school districts in Marin County these days. And so it depends. I'm going to, Sam, I know you mentioned when we were chatting earlier that your ninth grade was a little patchy, but did you receive at Tam High substance use education in the ninth grade or any subsequent years?
I think we did a little bit, maybe just for a little bit in ninth grade, but I don't think it was, as effective as it could have been, and they didn't really. I think they could have, repeated it, especially, in junior or senior year when I think it's more of an issue.
Absolutely. Stay tuned. You're a junior. My understanding is your district might do a little bit of a booster in the 11th grade. So I'm going to come back to you at the end of the school year and see if it happened, though. Okay. So it depends. San Rafael and Terra Linda high schools, those ninth graders in their health classes absolutely get about, I believe, 10 days of substance use education. Novato High School also has a class where it's integrated. But it varies. And to echo Sam's point, what we do know is a lot of times it happens in ninth grade, and that's about it. Whereas what we hear from young people is that as they get older, it becomes more salient. And there's a real need for discussion around safety planning, especially for our young people who might be going off to college. Marcella, is that? Yeah, hi. You can come off.
Hi.
Yeah.
I have a question. One of my biggest challenges is that I have teenagers in two different high schools in Marin, and I hear these talks and the support that the school tries to provide, and they do different talks, and it's like raise the bar and blah blah. But the problem is when you reinforce those rules in your household, the kids don't want to go have a party in your house, even though you offer them, I'll get you guys pizzas and I'll do this and I'll do that. They always want to go to the house of the parents that they know that they're either going to open the house for them and go have dinner outside, or be stuck in their room and let them do what they know they're doing, whether or not they are the ones providing maybe they don't provide the drinks directly, but they know that they're bringing them and they let that happen. So the kids only want to go to those houses, and that's what happens. And if you're the one that says no, then you're the bad guy, and they turn to go to the houses where they know that they can do that, and they don't want to go to the other houses. And even though the school reinforces it from the in perspective, nobody really will go to those parents and tell them they should not be doing that, or putting it
Marcella, I'm sure there's lots of parents here who are nodding their heads. Dr. Santora, do you want to
it's
respond with any of your
exhausting
thoughts
because I
to
hear
that?
that. Yeah, I hear that from the school, and but I feel alone, like completely alone. It's like my kid wants nothing to do about hosting poker night at my house, and it's because I'm not gonna let that happen. And I am really tired.
Yeah, let's hear, Dr. Santora, do you have any thoughts on that?
No, I think one, thank you for sharing, because I think that is one of the largest parent challenges that we have is, again, our teen kids want to socialize, and there are parents that will allow alcohol to be in their house, and our kids may or may not tell us that they're going to a house with alcohol, and we haven't created all of the consistent supports. We can have consistency in our home, but our community also needs consistency. There are social host ordinances where there are fines for hosting parties. That is part of our infrastructure, but I think some of the challenges we're facing now is that we have to revisit some of the policies and supports that we had before the pandemic. And I think that's why we're gathering here now, to reinforce and relight some of those supports so there is consistency in our community. And Sam, maybe I'd love to hear your thoughts around, I mean, that's just a reality that again, I said my 13-year-old wants to be able to go to a high school party and asked me if she could go to a high school party. So what are your thoughts about that? And what would you recommend to parents? It's a hard place being the bad cop or the bad parent, and excluding your kid from socializing with other kids.
Yeah.
Yeah.
I think again, like communication is very important because you want to, I guess you'd want to try to, show what you want, and also try to just understand what your kids want as well, and how to sort of, I guess, work your way through that together, I guess. And it's better than just, causing like a rift in relations sometimes.
Thank you, Sam. Thank you, Dr. Santora. I also want to draw everyone's attention to the chat where we've put in some links to a program called Be the Influence, which is for parents navigating this teen party scene. There's even some scripts in there that you can look at and see if they're helpful. But I think what's interesting is there's been quite a few little chats that have come in to basically say you're not alone. And when we can harness the power of the village of multiple people saying, yeah, I'm having that problem too, we get to shift the norm. Keep talking to other parents. We know of folks who have created essentially parent pods. It's harder and harder to know your friends' parents as they get older. Keep at it. It's super protective, right? To know the parents of your kids' friends. And we'll keep shifting those norms. But do check out the Be the Influence program as well. Dr. Santora, we have a question from someone who understands the importance of naloxone availability, also known as Narcan. But the question is, can the wide availability be perceived as permissive and giving kids the green light to use substances? In conversation with other parents, this seems to be the paradox for some. I love this question. Go for it.
Now, this is a great question. We were just talking to Lisa Miller from the County Office of Education today around this exact topic, is seeing the harm reduction again is potentially seen to teens as being it's okay for you to experiment and try pills because naloxone is there. I don't, from as a clinician, and as a clinician who sees the data from the community, I see the life-saving values of naloxone. So I would want, again, knowing that our kids can be ingesting substances that they don't know have fentanyl in it, I would want I would hope that someone around my kid has naloxone available, because we have, as you saw, there's unintentional overdoses that are happening in our community regularly enough that the availability is helpful. And I think it goes back again to having those conversations with your teen about, yes, we have this tool, but it's there as it's an emergency. It's like calling 911. And to not share a tool that could save a life, from my perspective, is withholding one of the supports that we need in our community. Sam, do you think kids see, I haven't heard it and I know I need to do research, but I know it's emerging, this conversation about not offering, naloxone and other harm reduction tools in the community, because it's us saying yes, that it's okay to do drugs. Do you have just a sense of that, as a teen? Is that a permissive?
I don't think so. I think it more just benefits in the case of an overdose, but I think a lot of teenagers might not be fully aware of those resources, so as well as that.
Yeah.
Thank you.
Yeah.
Thank you. Yeah. Any data we have on harm reduction, I think, plays out that way.
And I think also just one thing, I don't also want to say there are people with severe substance use that that will use drugs, have naloxone available, and then use drugs again. So I think that's, I mean, with humility, that it's not that this is perfect, right? Like there is that there are individuals that abuse naloxone, and are still abusing drugs at the same time. When I think of our adolescent population, I don't see that as the risk in that adolescent population.
Absolutely. Thank you. This is a great question. If you know the answer, Sam, is it your sense, do kids who use substances and kids who don't use substances socialize together, or are they mostly separate groups?
I think it also depends on the group, but I think in general, some people are, peer pressure, others more, but also I think a lot of the time, I think actually more so now, people are, respect others' opinions about why they might not be, you know, doing drinking or smoking weed or something like that, whether it's for academic or, athletic purposes, oftentimes they respect that choice.
Yeah, that's great to hear, Sam. What we've sort of heard, I think that mirrors this is, I think we grew up, everyone on this call, in a world where peer pressure was somebody being like, "Here, have the weed, have it."
Mhm.
And what we hear from young people now is that's not how it works. That there's an internalized pressure maybe around being a part of a norm, but that peer pressure in that traditional sense is not what we're seeing. It sounds like that's what you're saying. Yeah, yeah,
Yeah.
absolutely. Thank you. Okay.
Yeah, that's why I see like the next generation is so much more evolved than we were in their language, their acceptance, their inclusivity of different values and perspectives. And again, why I see them as the next greatest generation, because to exactly what you were saying, Jackie, we Gen X was a bit of a bully generation, around and trying to normalize many things about identity, and how people presented in their community. And again, I think our kids are better than we were.
Yeah, yeah. There's been a couple questions come up around the influence of parents and the influence of peers, and so I'm going to combine that into one question for both of you. Maybe Dr. Santora, you know some of the research. Sam, your lived experience as a teen navigating substance use. How important are peers in that equation, and how important are parents in that equation?
I mean, I think it's really important to have like a good family life and also good, relationships with friends. Like you really want friends who care about you and will, respect your decisions, and just good friends in general. So, I think because oftentimes, peer pressure, I think it's more subtle a lot of the time. You just think that everyone's doing, XYZ when oftentimes as the data shows, it's not actually true. So I think but if you have, good friends, you can kind of avoid that as well.
Thank you. And how important are parents? We hear as parents that as our kids get older, their friends become more important. Um, do we still matter? Do parents still matter?
I think definitely. I think although, as teens get older, they kind of turn more to friends sometimes. Parents are still, at the end of the day, they're still very important. And, you just spend a lot of time with them. So parents definitely influence their teens, just as much as anyone, even friends. So I think both are really important.
Thank you. Thank you. We still matter. There's a question here that might be our final one of the night. Is there data on substance usage in private versus public schools, and are they similar? So we have the public school data because they participate in the California Healthy Kids Survey, whereas private schools aren't necessarily held to that. Some might administer different surveys, some don't. So our data is not as solid in the private schools as it is with the public schools. Dr. Santora, do you want to comment on any of your understandings from that, if any, in addition to that?
I agree with you. So goes back to funding sometimes. So our public schools were funded back in the day to complete the California Healthy Kids Survey, and so that's what ensured participation. And our private schools have a different funding source, so did not participate necessarily. And I think there's an opportunity. Our board just approved a partnership that Marin Healthy Youth Partnerships is supporting us with, and kind of understanding the private school environment as well as our public school environment. And I think that's where hopefully 3 years from now, when we do this presentation, we'll be able to have that data. And it wouldn't matter whether you're in a private school in our community or a public school, that we're getting that information. Again, the risk. This is a risk that crosses every income, every race and ethnicity. It crosses our entire community. So the more that we can understand, the better we can design intervention. So that would be my hope, that 3 to 5 years from now, we would have that data for this group.
Awesome. Awesome. I think that's our place to land here. I want to make sure, Sam, that you see that comment in the chat that I agree with. You are a formidable young man. Thank you so much. This has been such a rich evening. Thank you doesn't cover it. Dr. Santora and Sam, you could take this show on the road. Truly, this has been really an inspiring evening. Thank you. And thank you to everybody who comes. You know, we've said a couple times tonight, I've seen it in the chat, it takes a village. This is the village. This is how we change culture and turn the tide. This is the bright future. So we'll see you all again soon. Thank you.